this morning's Health Watch, PRP therapy is a way of fixing a muscle, tendon, or a joint-related injury without surgery, and it is really catching on.
But the thing is, there's no firm evidence that this experimental treatment actually works, and medical correspondent Dr. Jon LaPook is here with more on it. Good morning to you, Doc.
Good morning, guys. PRP stands for Platelet Rich Plasma Therapy. Platelets are the part of our blood that's responsible for clotting and healing. Pro athletes started trying it about 5 years ago. Now, ordinary folks are requesting the treatment, and some swear by it.
We're both just happy to be moving again.
After enduring years of chronic foot pain, Linda Leonard is thrilled to be back in her boots.
You good girl, huh?
While riding 15 years ago, her horse stumbled, prompting her to jump off. Linda landed hard, shattering her ankle.
The angle, weight, momentum just blew it apart into 40 places. And I thought, I'm really in trouble. And I had to crawl out on my elbows, and I was laying by the side of the road.
After multiple surgeries, arthritis set in.
People who have pain every day, it's exhausting. I thought, is this going to be my life? And I thought, this is not even the essence of me.
Linda spent years searching for relief. Then, in 2009, she heard about an experimental non-surgical solution that claims to stimulate powerful healing. Linda sought out Stephen Sampson, an osteopath, who offers platelet-rich plasma therapy, or PRP.
What we do is we isolate the body's natural healing properties called platelets. We've learned that platelets release growth factor that stimulate repair.
The procedure is simple. A small amount of the patient's blood is spun in a centrifuge to separate and concentrate the platelets. Then they're injected into the injury. The cost varies from about $500 to $2,000, but is rarely covered by insurance because it's still experimental.
We've had success from head to toe, from neck, back, hip, knee.
But thus far, studies have not produced convincing evidence that PRP is a magic bullet for tendon and muscle injuries.
Does it hurt when I help?
Dr. Peter McCann is the chairman of orthopedic surgery at Beth Israel Medical Center in New York City.
The PRP is equivalent to cortisone injections. There are a few studies that show slight improvement, but it's really not an improvement that patients would appreciate.
That didn't stop former NBA star Maurice Taylor from trying it. He claims it eliminated pain in both his knees.
I'm very surprised. I mean, because it's a quick treatment. I'm surprised the treatment that takes so little time, has such big results.
But as editor-in-chief of the American Journal of Orthopedics, Dr. McCann says further studies are warranted.
Is the jury still out? Is it possible that
Absolutely, the jury's still out. We need more studies to figure out if we can select out those patients who will really benefit from it, because it does have great potential.
I was actually off the court and away from training for maybe 2 days, and then the third day I was playing basketball.
Taylor now plays for a team in China.
She wants dinner.
And Linda Leonard remains free of crippling pain.
Let's go. Maybe it won't work on everybody, but it worked on me. It's dinner, isn't it? It's given me my life back. Come on.
PRP is not yet FDA approved. The agency told CBS News that licensed medical practitioners can use it, but they cannot claim the treatment will actually correct any problem.
Interesting, but you do see these examples where perhaps it did correct a problem, or maybe it was some other circumstance that helped. Is it just a fad, in your opinion? I mean, why are doctors prescribing this for people?
Well, I think patients are coming in and are asking for it, right? And it's the classic clash between belief and evidence-based medicine. Now, last year, the Olympic Committee, the International Olympic Committee, commissioned a report saying, let's look at the entire world's literature and see, does it work? Well, they found that it was safe so far, although there are no long-term studies. But in terms of it being effective, jury's still out.
Yes. I mean, athletes, because we've been talking about this, and they've been talking about it for the last 5 years. There was even some question to the legality of it with some athletes for years. I mean, are the results, we hear from more Taylor in the piece, but overall, are a lot of athletes thinking that this is the way to go to get them back on the field?
Again, it's anecdotal so far. Somebody comes in and says it works for me. You know who was not in today's piece? My friend Richard, who had an injection in each Achilles tendon for $2,500 each, and it totally didn't work. Of course, we're not going to put him in a piece like that usually because it's not a great result. I think there's a very important study that people need to go back to.
Yeah.
About 10 years ago, everybody knew that if you had arthritis of the knee, you just do an arthroscopy, you clean it out, you clean out the schmutz, the debris, you smooth things out, and things get better. And people said, I get better with this. Well, so they said, let's do a brave study. And it was brave. 180 people. They divided them into 3 groups. One had the actual arthroscopy. They washed it out. Another had the debris cleaning procedure. The other had placebo. They made a couple of cuts and they did nothing. There was no difference between the three groups. And interestingly enough, all three groups got better. So what is the contribution of the placebo effect to this? Right. Placebo is very powerful. And until you do these controlled studies, you really don't know for sure.
I was thinking about that placebo effect. If people are going to their doctors and demanding this, where do you see it all going and shaking out?
I think it goes to informed patient consent, informed decision making, which is that the doctor really says, in the privacy of that office, what really goes on when you're looking that patient in the eye. Are you saying, I'm telling you, this works. In my hands, it works. But are you saying the honest truth, which is, look, the jury is still out.
Dr. Jon LaPook, thank you so much.
Thanks, Doc.